Would improved funding for housing decrease the burden on hospitals?
We know that there's a huge relationship between housing and health. And this is for every reason. Housing is the foundation of our well-being. We look at the determinants of income and housing are two absolutely fundamental and related issues. And yeah, I mean, there's really, simple pathways for that, such as, people in unhealthy housing, with mold and pests and those sorts of things, obviously are more likely to acquire disease. But then, of course, more complex pathways in terms of without stable housing, it's hard to access education, access employment, build strong social networks. And so if we want to change the story around health, absolutely, it's kind of two investments that are needed. One is to improve our primary care services. Because of housing loss, you're not disconnected from quality primary care. And then secondly is change the housing story. And so, another way that we can ensure that we don't have to replicate health clinics for homeless persons across the country is decrease the number of people experiencing homelessness. So absolutely investments, and there's been research on this that has showed, the actual dollar values around the return on investment. If we put this much money into quality, stable, permanent housing, then you save this much from criminal justice system, health system, child welfare system, which are all of these in a ways kind of patching in for what the housing system isn't doing. Now, so then why aren't we? If there's like a simple economic argument that says, hey, look, the government can save money if it just provides housing. The unfortunate part of this is that our system isn't designed to incentivize any one ministry to save money for another ministry. And because we do have kind of this siloed nature around our budgets, is that if the housing system spends a bunch of money that saves the health system, then the housing system is just questioned for why they're spending so much money. And then the health system just has more money to spend on other things that are also important priorities. And so, unfortunately, we don't see a lot of those economic arguments picking up much traction at the government level.
For sure. Same with that prevention, right? In public health, the prevention piece.
Yeah.
Yeah, it's not funded as much as, things like the ACE study and various things tell us that we need to get in there to save the money. The incentive isn't there.
Yeah.
And the funding support isn't there to be able to do that.